Okay, I think that's my microphone is working now, so I think that's the sign it's time to start. Good afternoon, good evening. Thank you to all of you who are here in the room with us now, and greetings to all of our participants who are joining us online. My name is Alison Mawson, and I'm a program manager at EuroHealthNet, the European Partnership for Health, Equity, and Wellbeing. I'm delighted to be serving as your moderator for this session all about social green and arts prescription, and I look forward to the discussions that we'll be having together. So by the end of the workshop, what do we hope that we've achieved? We hope that each and every one of you comes out of the room with a better understanding of social green and arts prescription, and importantly, inspiration, so that you can work on these promising interventions back in your own context. To achieve this objective, I'll be joined by a phenomenal panel of experts and leaders who are going to be telling you all about their experiences, including their challenges and their successes, and when they're putting social prescribing into practice. And in addition, we're delighted to have not one, but two artists joining us for a session on arts prescriptions. It seems only appropriate. So Richard Fils will be engaging us all in a short session or two of body percussion. So we'll give you a demonstration of that in just a minute. And then our cartoonist here, Florist Oudshorn, will be preparing a series of cartoons that you will get to see at the very end of the session, helping bring our session to life in a visual format. And last but not least, I'm delighted to be joined by my dear EuroHealthNet colleague, Afsana Najat, who is womaning the news desk for us this evening. And please feel free to send in your questions, your comments, your thoughts. We look forward to hearing what you have to think. But wanting to keep us to time, my introduction's very short. We have one more visual arts form that we will be presenting to you now. That is a video which will be telling you all about arts on prescription, which is one form of social prescribing. So if you could please launch the video.
In a world where stress, depression, and anxiety are on the rise, a novel solution is emerging: arts on prescription. When we look around us, we see a lot of people struggling with feelings of isolation, loneliness, or hopelessness. But what if we told you your well-being can be improved by getting a prescription for creative activities? Arts on Prescription, or AOP for short, is a community-based intervention designed to improve the well-being of people through engagement in arts and culture. It has been tested in countries like the UK, USA, Australia, Denmark, and Sweden with promising results. One way to implement AOP programs is to bring together groups of about 10 individuals for 8 to 12 weeks of artistic or creative adventures. During these programs, participants dive into a world of creative group activities like shared reading, dancing, singing, and painting courses. It's a break from the struggles of their daily lives, a chance to let their creativity flow. By engaging in these artistic activities, participants enter a safe space that is free from expectations and societal pressure. The creative activities offer room for imagination, aesthetic and emotional expression, and relieve people from stress. Moreover, their self-esteem can soar to new heights, and they build social connections, fostering social engagement. This means that arts on prescription programs not only can unlock creative potential, but also have the possibility to enhance mental well-being and social interaction, ultimately leading to improved overall well-being. The most important benefit is the enjoyment and satisfaction that comes from engaging in creative activities, which contribute to a positive outlook on life. So remember, in a world filled with challenges, Arts on Prescription is painting a brighter and more colorful future for us all.
Great, thank you. So I hope that gives you a sense of one flavor of the various flavors of social prescribing, and to give you a first-hand experience of some of the things that you might experience and do yourselves when you would go to an Arts on Prescription session. I'm delighted to invite our colleague Richard Fils to come to the stage and do a short demonstration of body percussion. While he's coming, I will introduce him. Please come on up. He's a percussionist, educator, and researcher. He studied jazz drums at the University of Music in Vienna and the Vienna Conservatory, and trained with the Drummers Collective in New York. He earned a Master of Arts in Jazz Drums in 2008 and a PhD at the University of Music and Performing Arts in Vienna in 2012, with his dissertation focused on rhythm coaching. So thank you so much for being with us, Richard, and the floor is yours. Wow, thank you so much. Yes, please take a seat. And I hope you have a 101 level of that for all of us a bit later on. I'm not sure if I'm ready to do that in front of an audience. So thank you so much. That's wonderful. And really looking forward, once we've gone through our speaker spotlights, to having a chance to practice that with you. But now what we will do is we'll start a series of short spotlights in which each one of our expert speakers is going to face the challenge of condensing decades of hard-won experience into 5 minutes. So following these introductory remarks that we will have from each one of these speakers, we will open the floor again to them and to all of you and our online team. We'll be having 30 minutes of discussion. And again, what we hope you'll take out of this is practical inspiration, insight. You'll feel like you could take action and work on these things back in your own context if you feel so inspired. So again, take notes. In the meantime, you can send them into Afsana. Hold on to them for us because we will have a discussion at the end. But for now, I'd like to invite our first speaker, who is Professor Sonia Dias. She's joining us from Universidade Nova Lisboa, where she's a director and full professor of the National School of Public Health. She's also an executive board member of the Comprehensive Health Research Center. Her research addresses health promotion, disease prevention, literacy, and inequalities with a focus on vulnerable groups. She's also led numerous participatory public health interventions and advises organizations including the ECDC, WHO, and the IOM. And she serves on UFA's Steering Committee on Migrant Health. Sonia will speak to us about exactly what counts as social prescribing, the evidence of a need for such interventions, and how they're putting it into practice in Portugal. So thank you for being with us, Sonia. The floor is yours. This floor.
Hello everyone. It's a great pleasure to be here. And just in 5 minutes, I was asked to explore a little bit more what is the advantage and what are we talking about when we talk about social prescribing in a broad way. So first of all, we all know that social determinants of health, in fact, attends more than 80% of our health. But in the same way, we know that healthcare is very difficult to act alone and address all alone. So the first important issue is that social prescribing is in fact an initiative that can address the factors that shape our health and well-being. Second, we also know that all the pressure that health systems has today with the growing of aging population, but also the increasing chronic diseases, we know that we need a paradigm shift when we're talking about healthcare. But in fact, we need that healthcare goes beyond treat illness and goes more focused on health promotion and disease prevention. But in fact, I don't know all the context, but at least in Portugal and other countries that I know, in fact, it's really difficult to implement initiatives in health sector that really deals with health promotion and disease prevention. And in fact, social prescribing, at least from what I have experienced, in fact, it's really a good way of operationalizing these concepts in the health sector. Second, when we are talking about health promotion, we know that we really need active participation and meaningful engagement of participants if we really want them to be empowered or to have an active role of their health. So social prescribing also promotes the empowerment of people. And it really, I think this is quite important, it really tailors the needs, the values, and the preference of each one. So we are really talking about a person-centered care. And I listened something when I was sitting there, so just 1 minute, but I think it's quite important. Someone said, oh, I'm really not good on painting. And this is something that it's quite important, because maybe you don't like to painting. Okay, no problem, you are going to dance. So this is something that it's really focused on what we really like and we really need. Then it is also important that we are always talking that we need an holistic approach of health. But in fact, for doing this, we need a multi-sectoral approach, and it's also quite difficult, at least in some countries, to move toward this. And social prescribing is also a way of doing this kind of integration of healthcare with community resources, integrating healthcare that goes behind the prescription. Now I need to. Okay, so very briefly, just to highlight some of the benefits of social prescribing. And in fact, social prescribing, when is really well implemented and well developed, we have now huge evidence that there are different benefits on the level of individual health, family and communities, on the level of integration and intersectoral approach, and on the level of sustainability of health systems. So when we talk about individual health, we have now increased evidence that show us that there is very good indicators of better health, reduce of isolation and mental health problems. Also, communities and families are much better because we are also increasing the social cohesion and the local networks. And also, it's quite interesting because social prescribing has also shown that it's a way of maximizing resources and avoid unnecessary clinical interventions that add costs, sometimes with no improving of health outcomes. And the other way, we have also data that show us the health level also supports the sustainability when we try to implement, social prescribing. Namely reducing the load of healthcare services while we are increasing the social return and cost effectiveness of care initiatives. So finally, just to give you a very broad highlight of the Portugal experience, and then we will have more time to discuss. But since the first social prescribing pilot, we have been, and the National School of Public Health has been expanding social prescribing in Portugal. We now provides technical and scientific support. I normally tend to say that we explain social prescribing in 2 or 5 minutes like I'm doing now, but believe me, it's much more difficult when we are implementing in the field. So what we have learned is that with a lot of pilots that we have also worked with in terms of technical and scientific advisory boards and helping implementing and try to design the new projects in health units, but also municipalities and in third sector, we decided to all the accumulated experience to create a knowledge center in order also to boost the social prescribing in Portugal, but probably more important, to produce evidence that we're being able to use in terms of integrating these initiatives in the health sector, but also in public policies. And we are in the process of that. So besides the consultancy that we do to other projects, we have also trained health professionals and social professionals, and we have a Portuguese network on social prescribing. We share the knowledge, share the lessons learned, and we also share the projects that we have. Finalizing, we also understood that capacity building, it's really important to have a successful project. So we have developed a social prescribing implementation manual that it's in Portuguese, so sorry, and one online training, social prescribing from theory to practice. And then we are also involved with Alison also and other colleagues in international consortiums where we are trying to develop the concept and methodologies, and we are now also in Portugal. We are using participatory approach, co-creation approach in social prescribing initiatives, but also using implementation science frameworks in order to try to design, monitoring, and evaluating a complex intervention. And it's really a complex intervention because we are dealing with a different way of considering healthcare, but most of the time we are also dealing with the day of moving from a biomedical approach to a more holistic approach. Thank you so much for your attention.
Thank you. Thank you very much. And please feel free to take a seat. Yes, I think there's a lot that we can continue to unpack around evaluation, capacity building, so many different, even the specificities of how you scaled in Portugal. I think there's a lot we can continue to discuss. So thanks so much for setting the scene for us. We will now go north. We're going to head to Denmark, and we're specifically going to go to the cultural region Funen. I'm probably pronouncing it wrong, Stina, sorry. And our colleague Stina Kleding will be telling us all about the work that she's been doing there. Let me just introduce you, and the floor is all yours. Stina Kleding is Program Manager for Cultural Region Funen, a Danish partnership of 9 municipalities funding long-term cultural initiatives. Since 2019, she's developed art on prescription programs regionally and internationally to promote mental well-being, and now leads the Art on Prescription project that we'll also be hearing about from our colleague Ulla Karin. With over 15 years of experience in cross-sectoral project management, she specializes in knowledge exchange, co-creation, and policy development to deliver cultural and community impact. So Stina, you'll be telling us really all about the nitty-gritty, well, in 5 minutes, you'll be giving us a sense of the nitty-gritty details of implementation. Thank you so much for being with us.
Yes, thank you for the introduction and thank you for being here. So since 2016, Funen, which is the second largest island in Denmark, has been running arts and prescription. And the initiative started in Nyborg, which was one of 4 municipalities in Denmark selected by the Danish Health Authority to test the first AOP programs in Denmark. Between 2016 and 19, Nyborg tested a 10-week program where people with mild to moderate mental health issues took part in different group-based arts activities. The evaluation of the pilots in Nyborg showed significant improvements in participants' mental well-being, social connectedness, as well as overall quality of life, and actually inspired the remaining municipalities on Funen to co-test the AOP concept through a regional initiative in Danish called Fynsk Kultur på Recept, in English, Arts and Prescription on Funen in 2022 to 23. The initiative was co-funded by the 9 municipalities and the Danish Ministry of Culture through a cultural agreement they enter every 4th year to try out and invest in new and innovative cultural projects. The money was spent on knowledge exchange, workshops to create cross-sectoral teams, staff training, evaluation, as well as salaries for the payment of a local coordinator and the cultural facilitators in the municipalities. Thanks to the strong outcomes of the Funen program, including, as well as in Nyborg, strong improvements in mental well-being among the participants, but also a strengthened cross-sectorial collaboration, the municipalities have now become increasingly committed to continuing AOP activities and to co-design new arts and health initiatives together. 3 municipalities have actually implemented AOP as permanent offers, and 1 municipality, Odense, has taken part in arts and prescription in the Baltic Sea region. A new art and health network has been established, and 7 municipalities have received around 1 million euros from the Danish Ministry of Culture to offer cultural activities to disadvantaged young people outside the labor market and the education system. And well, the Funen municipalities have received this money because they now have increased knowledge of the target group, as well as they can show great result in actually improving lives via the arts. So, some of our primary challenges working with AOP has been to recruit young people to the programs and to engage GPs and other healthcare professionals as referral channels. It's been difficult to attract young participants because these are some of the reasons why, not all of them, but one of the reasons is because they can feel anxious about joining new initiatives, especially when they don't know the other participants. It's challenging to recruit young people in the educational system because they don't have time to take part in activities during the daytime. And mental health issues is a big taboo among young people. So what we are trying to do to solve this is to work to destigmatize mental health challenges, to let the young people sign up in pairs, allowing them to bring a friend, and to focus our recruitment efforts on young people who are also outside the educational system. Engaging GPs and other healthcare professionals has also proven difficult due to limited awareness of non-medical support options like AOP, the absence of an official framework for AOP in Denmark, which creates uncertainty around its legitimacy and integration into clinical practice, as well as time and resource constraints and skepticism towards the program's effectiveness. So what we have been doing is to include a variety of referrals channels like psychologists, student counselors, social workers, and that has brought us the amount of participants that we need. The referral channels and the GPs who have supported AOP recruitment are typically the referral channels who have actually tried arts and prescription activities themselves, because when you experience AOP firsthand, it is a powerful way to truly feel and grasp how art-based activities can support mental well-being, and therefore makes it easier for them to believe in the program, but also to sell it afterwards because they know what it is about. I therefore strongly recommend that all key stakeholders in an AOP program, politicians, sector leaders, recruiters, they engage in AOP themselves beforehand. As one senior leader put it, while I was drawing this picture today, it was the first time in a month I forgot about my troubles. After that experience, he was hooked. And despite the challenges, I also highly encourage the formation of a cross-sectoral team to co-design AOP programs. AOP initiatives are inherently cross-sectorial and must be tailored to diverse objectives and needs. This approach fosters system thinking and avoids fragmented solutions and develop a shared ownership and responsibility, often paving the way to joint funding opportunities, which is also the case in Funen, because the municipalities who have actually been able to create these permanent AOP programs are funding them and structuring them through a cross-sectorial collaboration. That was all for me.
Thank you so much. And really, I mean, I loved what you had to present because it feels like it's really a success story. You know, we talk a lot about great initiatives, but this is something that's getting sustained, where there is this active, continuing commitment to doing it. And that's so exciting to hear. And it's exciting to hear we had these challenges, but here already are the solutions. You know, bring a buddy, find different referral channels. So excited to continue the discussion about all the work you're doing there. Thank you. And now, just trying to keep to time, I'm going to already hand the floor to my collaborator, or co-conspirator for this session, Dr. Ulla-Karin Nurm, who has been working with her wonderful team at NDPHS to make this session come to life, along with EuroHealthNet. So thank you so much for that. Dr. Ulla-Karin Nurm is Director of the Northern Dimension Partnership in Public Health and Social Wellbeing and coordinates the EU strategy for the Baltic Sea region's policy area health. She's a medical doctor with over 20 years of experience in public health and international cooperation. She has led European initiatives on disease prevention, health promotion, and risk communication. Her current focus is on advancing cross-sectoral collaboration, we heard a lot about that, to strengthen mental health, workplace well-being, and active aging. So today, Ula Karin will be providing us with lessons from the Arts on Prescription project, the one you've briefly referenced as well, and focusing on the added value of cross-country collaboration. So thank you so much, Ula Karin. The floor is yours.
Thank you so much, Alison, and welcome everyone. And I'm so glad to see that we still have a room full of people, because we are going to have a very exciting part of the session coming soon after my presentation shortly. And I'm going to share another success story, which is actually stemming from what Stina was just describing and telling to you. The project, EU-funded project AOP, Arts on Prescription, that is now running to its end. It's a 3-year project, and it is covering 5 countries and was it 24 pilot sites. And that this is now the time actually to bring all the results together and to tell you a little bit about this experience. There has been several arts and prescription and social prescribing initiatives, as you heard already also from Sonia, and you probably heard other things as well. But what is very particular about this project is that we really tested a common model that was developed, and that is based on the Odense model before. So we had this common model handy, and then we adjusted it into different contexts, different countries, different settings. And we realized very, very quickly that it's actually not possible to run it designed in a similar way in all the countries. So that was the very first lesson learned, that we really had to the local pilots had to be tailored to local needs and circumstances, and they looked vastly different. And so it was tailored based on what was mostly needed in each community and which cultural resources and other community resources were there available. So I have to really emphasize it, and I will do it maybe next several times here, that this is a community-based intervention. And there has to be those basic health promotion elements in place, and these are the community resources that you build this program on. And now some examples. Our Polish partners, for example, they organized their program for young people, and they cooperated with schools. So it was very important also to have a referral mechanism, and there the schools and the school psychologists were the referral mechanisms. They adapted their style of communication and their activities to what would be most interesting for the young people. Our colleagues from Latvia, from CESIS, on the contrary, they created groups of all ages, and their audience was from 25 to 86 years of age, and they implemented radical inclusivity in mind, ensuring the venues and activities were accessible for people with disabilities and with different needs. That also created another layer to this implementation, another, not hassle, but another layer that you really need to consider if you have the transport and how to make it accessible so that you don't create another inequity in the community. So that not only those who always come and who have the better access also access this program. And in this CESIS piloting program, they managed to create a community of people that would never otherwise meet in their daily life. And that was a very particular thing. In Bremen, in Germany, EOP activities were integrated into the offerings available through the local adult education center. So they also built on what was already available there. And they created mixed groups. So there were resources for arts classes and other creative activities. And then they mixed the groups. However, the group of the AOP program, they received special support during the sessions organized specifically for those participants. But they could also follow then the dynamics of the mixed group. So despite all the pilots taking such different shapes, we also realized that everyone actually shared very similar challenges. And that was something, a thing to learn, and that was actually the very big value of this EU-wide project, because we could so much learn from each other, share, and the people brought to the table, to the discussions. We implemented the mentoring part of the program, and the common challenges were all that how to set up sustainable referring systems. What are the referral channels? They are very varied during our program. And I don't think, Stina, that we have actually one unique recommendation how a referral system would work. Primary healthcare was used as a referral, and this is probably one of the most sustainable referral channels and something that we would aim in the policy recommendations. But there were others. Even self-referral was used. Another challenge was how to keep participants motivated to join each session, because people also come with very different backgrounds and also different issues and problems in their life, struggles in their life, and that was not very easy to keep them motivated so that they would go through the whole program. As mentioned before, the program lasted 10 to 12 weeks, meetings every week, 2 times per week, a couple of hours, and some people, they don't really have the strength when they face difficulties in their life. But then we had the link workers who were the supportive part, the broker part, who always were the ones who supported, and the one single figure who was out there. And then, of course, the how to handle the potential meltdowns in the group or crisis. So that was another common issue. So all those things that we shared and we learned from each other is now in those brochures that are also delivered here. So if you are interested, you can take it home with you. So these are the outcomes of the project. From all the learnings from these sites. And the material, if you didn't have it on your chair, you can pick it from the table there. And there is another thing that all pilots had in common, and that is the impact the AOP programs had on the participants. Ideally, we would have a participant in our panel today, but this was not possible. And therefore, I would like to read a quote for you. And this is how people have described their experience with participating in an AOP program. Some of the quotes are also on the wall, but this particular quote, I would like you to listen. Today, I was able to release so many emotions: rage, grief, enthusiasm, and happiness. I shouted, moved my body, and let it all out. It felt like I was letting go of the heaviness in both my body and mind. I cried, and in those tears I felt both sadness and a deep sense of relief and joy. Thank you very much.
Thank you. Thank you. It's really wonderful indeed to hear. I think this really demonstrates the value of cross-country collaboration very well and why it's so important that we come together. We can't, there's so much, but it is finding that tension indeed always, and it goes well beyond social prescription. It goes to all kinds of questions in health promotion and this idea of best practices. You know, what are the things that work? What are the common challenges? What are common solutions? Could the guidance from Portugal be adapted and be useful? I have many questions still, but I hope we'll have time to explore that. But we do have one last speaker that we want to make sure comes to the floor. I'm honored to be inviting her. Unfortunately, it is not the Acting Minister of Health, who could not be with us today, Dr. Jakubowskiene, as she had urgent meetings back in Lithuania to attend to. But we're delighted to have her advisor, Ms. Neringa Grigutite, who is an associate professor and senior researcher at the Institute of Psychology at Vilnius University. And prior to becoming advisor to the minister, she held the position of head of Department of Clinical Psychology at Vilnius University and has worked as a counseling psychologist and supervisor at the Department for the Welfare of the Community. So it's great you could step in. Occupational hazard, I guess, working as the advisor. We'd love to hear how what you've heard resonates with the plans you have in Lithuania. So thank you.
Thank you very much. I'm very delighted to join this discussion. But first and foremost, please accept the warmest regards from the Minister of Health, Maria Kubauskienė, because she really wanted to be here with all of you, and she planned this, but at the last moment her trip was cancelled. But she assured me that in her heart she is with us. So thank you very much. And now what I heard, I will try to shortly explain what is going on in Lithuania. And from governmental side, we should talk about money. So it's one of the very important things to have stable funding for this. And I'm very glad that Lithuanians' commitment to social prescribing is a national strategy. So we have funding for this, and it is very important. And how it works in our country. So from 2023, we established the legal and procedural basis for social prescribing and finance coordination or link workers, where the targeted state grant to municipalities. We started from 4 municipalities, and now we have 18 municipalities, and coordination is delivered through municipal public health bureaus. So the pathway is visible and accountable inside the system. Other thing I think is very important to have a targeted group, and we heard about young people, but in Lithuania we decided to have people 65 and more, those who retired. It's one, important thing, and they aim to reduce loneliness, strengthen mental health, and build skills for independent living. But what is also very important, I think you know that Lithuania have suicide rate is among the highest. And so we are happy that in the last year it has been declining. But however, while overall suicide rates are declining, suicides among older adults are on the rise. So it's very important for us to do in this target group. And we also have numbers that almost 50% live alone and nearly half experience loneliness and social exclusion. So this group is very important for us. And there were already presented all the challenges, because our first results also show positive findings. Primary data show that strong participant certification and high demands for activities such as artworks, cultural participation, physical well-being classes, and volunteering opportunities. Still, we have challenges, and these are also mentioned a little bit. So, low engagement of general practitioners and other health professionals in referrals. We are also thinking how to do this, and one of what we thought it maybe strengthen engagement by highlighting evidence of health impact. And also these brochures you showed, I think it's very important for medical doctors and other healthcare professionals just to know that it works. Not only just that we talk about this, but in the whole Europe we know that it works. Also, what we know that heavy administrative burden, I don't know, it was not mentioned, but still, if you have no time to meet with people, I mean, with those who organize all these activities in one hand, but in other hand with participants, and you refer, as for everyone, just go there, they would not go. We can offer something, and we should, personalize what they need. It is also very important. We also, it was mentioned that some people sporadically attend activities, and how to unite them and need not to go to one or two activities, but for the whole circle is very important true. These challenges remind us that legislative support and funding are necessary but not sufficient, and implementation requires continuous adaptation and co-design with professionals and communities. And now we are thinking how to reframe all this algorithm here in Lithuania. But still, there are a few moments I would like to mention before sitting in that chair. It is. I started with funding, and I think it's very important to have not one side funding, and we started to think about mental health in all policies, and we have already new mechanism from Culture Ministry, and it's coming 9 million euros for art prescribing and social, and it is, I think it will work. Maybe we will try to do with other ministries also. It's quite difficult, but still. And the last thing I need to focus, it is very important, just I will talk like a clinician, not to stay alone. And when I say this, I mean not only our participants, because we talk about, for example, older people loneliness. We cannot stay alone when I mean coordinators or link workers, or even these who provide all these activities for people, but from the side of ministry, not also not to stay alone. So I'm very glad that you invited us here, and we can hear from you all the lessons and share our lessons with you. Thank you very much.
Thank you very much, Narenga. That's great to hear, and I hope indeed this is just one in a series of continuing opportunities to continue to collaborate on this. I've not done very well with my job because it's hard to cut you off at 5 minutes because there's really a lot of interesting stuff to say. But I also don't want to cut into Richard's time. It's now time for all of us. Get ready. I hope you paid attention during the demonstration and you can do all those moves he did. No, Richard has 9 minutes to give us a rhythm coaching here. I will try not to embarrass myself. I hope I can turn the mic off for that. Thank you so much, Richard, for, again, helping to bring to life all these things that we're talking about. I hope we all feel a lot more joyful after these 9 minutes. So please, it's all yours.
Are you ready? Are you ready to join me? So please, play with me. The lyrics are, okay? So please imitate what I do, please. Faster. Ooh. No. Oh, you. Yeah. Yeah. No. Please speak with me. I'm all set to go. 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 You're 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 all set to go. This is the thigh of your right neighbor. So please introduce yourself before you hit the thigh of your neighbor. So this is the thigh of your right neighbor, okay? Careful. Yeah? With me. You're all set to go. 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 We're 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 all set to go. I'm all set to go. You're all set to go. We're all set to go. Let's put on a show. Okay, together. Please get ready. Slow. 1, 2, here we go. I'm all set to go. You're all set to go. We're all set to go. Let's put on a show. I'm all set to go. You're all set to go. We're all set to go. Let's put on a show. Fantastic. So now we play with some music. Oh, turn it on. We start by nodding the head. Please speak with me. Now let's play. Set to go, we're all set. We're all set to go. We're all set to go. And get up and dance, dance. Dancing finished. Freestyle, freestyle. 1, 2. Now we do the 4 bars. You, me. Okay. 1, 2, here we go. I'm all set to go. You're all set to go. We're all set. Let's put on a show. I'm all set to go. You're all set to go. We're all set. Put on a show. Freestyle! Final pose. Yeah. Next one. Next one. Please speak with me. Hey, how are you? 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 Hey, how? Hey, how cross are you? Hey, how? Very good. Double speed. Hey, how are you? Hey. We stop speaking. We look at our neighbors. We look at our neighbors. And we ask our neighbors, hey, how are? How about you? Hey, how are you? How about you too? Hey, how are you? How about you? Hey, how are you? How about you too? Hey, how are you? How about you? Hey, how are you? How about you too? And we need one more. We need the stomp, clap, butterfly. Hands like this. Hands like this. Lift for 10 centimeters. We hit the upper arm. Hands go there and back. This is the butterfly. It's called butterfly. Butterfly. So we have the stomp, clap, butterfly. Stomp, clap, butterfly. Stomp. Now you're ready for the musical highlight of the day. Now you're ready. So you know you're in the country of Salzburg. So we need some music from Salzburg. With me. Hey. how are you? Hey, how are you? Hey, how are you? Phrasing. You. Hey, how are you? Hey, how are you? How about you? How about you too? How about you? How about you too? Hey, how are you? Hey, how are you? Hey, stomp, clap, butterfly. Stomp, clap, butterfly, stomp. This is already the third lesson. Stomp, clap, butterfly, stomp, clap, butterfly, stomp. From the beginning. Hey, how are you? 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 Hey, how hey, neighbor, neighbor. How about you? How about you too? How about you? How? Hey, how are you? Hey, hey, hey. Please get up, please get up. And now, stomp, clap, butterfly, stomp. Now we turn, now we turn. Hop. Keep going, up, up. What is a show here? Watch the clock. Watch the clock. Thank you very much. Thank you very much.
Wow, thank you so much, Richard. I hope you all feel more joyful. And if you feel more traumatized, like I do, then maybe painting's your thing. So thank you so much. That was brilliant and a lot of fun. And now, we hope you got your creative juices, your thinking hats on after being inspired. And we'd love to hear if we have some questions coming from the audience. I'd love to come to Afsana and see if we have some questions also coming from online. So I see a couple of hands. I think I saw yours first, but then after in pink, please. There's somebody with a microphone, no? I think she was first. So, I'll come after. Please. Yeah, it's okay.
Okay, great. Fantastic session, really interesting. My question would be about, we talk about prescription, but there's so much we can activate the community, in the community without a prescription. So what is the role of cities in putting parks, in putting elements in the park that invites to be active, to do things together? There are some municipalities that do a lot. This is something that you consider, and how can we get the clinical or medical side to buy into that, to kind of know about it, and then without really a prescription, like inviting people, but why don't you go in the park and play, or also the sport facility doesn't need to be reinvented, that they can be used also with new technology. So it's a lot of possibilities without, it's great to have an animator like you, but even without, we could do a lot. So I would love to hear your ideas on that and see what can we learn from those examples and how to use it in the future. Thanks.
Thank you so much. I think, any one of you could take that question. Would you like to start, Sonja?
Yes, just to give some ideas. So I think it's not completely new, and I think it's important to highlight that it's not completely new that physicians or medical doctors normally tend to also approach people and say maybe it's good to do some exercise. But I think social prescribing, and here the social prescribing, it's a broader way of arts and green and other activities. I think it's important to highlight this. But I think here we have 2 or 3 elements that are quite different from what we have seen before. One is that although we have a lot of discussions about the word prescription, because it also links with some authority, so someone will prescribe to the other. But in the other way, prescription is what was also used because people tend to agree and tend to see that this kind of different ways of having healthcare, it's also a prescription. So there are 2 ways of thinking about this. But I think one important issue is that the person-centered element here and the issue of the values and the preference of the people. And now you have someone that are going to talk with you, the link worker or other words, but someone that are going to talk to you, to understand your needs, to understand your preferences, and will choose taking into account what you have in that context, the resources that you have, and try to see what kind of activities are more linked with your preferences. So I think this is something that it's quite different. And we don't have time here, but we discuss a lot the issue of monitoring and evaluation. And this is I think, quite different, because we have a long tradition on trying to people doing different activities, but we don't have the evidence that this kind of activities and this kind of initiatives are really important to move forward. And just a final element, at least from our experience, it's quite interesting because it's the physicians and the medical doctors that are really trying to that are really motivated to start this kind of initiatives, because they see their patients. Most of the time they see that they come to the consultation and they see that they are having increasing the obesity indicators, or they are unemployed, or they are widow, and they see that probably in 6 months they don't have the solutions, and in 6 months they will see the worst indicators in that kind of patients. So they are really aware and they are really motivated to try to find other ways. So I completely agree with what you are mentioning, but I think it's also important to see what kind of critical elements social prescribing has, in order also not to consider every activity as a social prescribing initiative. And so, but it's quite tricky, and I understand completely what you are mentioning.
Thank you. If you can, you have a microphone, please.
Thank you. I would like to add here that in these AOP programs, we try to actually address it for people who do have mild or moderate mental health issues. And the one of the main aims is to have it a non-medical approach, so that it fits into the stepped care model, so that this is something which is offered outside of the healthcare. So to take away the burden of the healthcare that is not really coping with the increased burden of mental health issues, and therefore it's a. There can be definitely, of course, I think we all want to have, access, a lot of access to creative activities that children would have from their early childhood, attending arts classes and other creative things, and also environmental, the green bathing. But this is specifically a programmatic approach that has some very concrete results, because the sporadic interventions, they also do have an effect throughout the life course, but this is more, really trying to take a role in as a low intensity level intervention for mental health.
Yeah. Thank you. Just one more.
Just a very short comment too. Some of the participants who are taking part in arts and prescription, they don't dare to go to a dancing class by themselves because they feel alienated, or they need the very specific support, and they need to know that they are amongst equals. So I agree. A lot of people can benefit from going to activities, but some of them has to have it tailor-made and facilitated.
Thank you very much. I believe we had another question, yes, here in the front.
Yes, we do have this model in
Could you bring a...
primary healthcare centers. I'm a professor of psychology, and I love that mental health in all policies. I think it's very important, and that's what we do. I would be interested in two things. What are the best experiences you can give us, how to motivate the doctors to bring in these programs? I have no so very good experiences on that. And secondly, what's about the link workers? What is the really positive effect of them? Because also, maybe I did it wrong. I don't know. I was not very successful in that. And certainly, thank you very much for your presentations.
Thank you. Would, I think, yeah, do any of you want to take it first? So.
Well, I can say from our program, it's a little different from the whole social prescribing, but the link worker in the AOP program takes part in the activities together with the participants, and because they go to different venues, it feels more safe. They have a steady figure, and then they go out and explore the world. So it's someone who supports them.
Can I just add that I think the question it's really important, and at least from our experience, that's why we mentioned the capacity building component. It's really important, and at least from our experience, we are really committed to give training for the different parts of a program of a social prescribing initiative, because the link workers can be different professionals with different backgrounds also. So I think the training in the beginning, just to understand what kind of position they should assume, what kind of challenge they will have. I think depending on the program, for example, if it is more related with mental health or aging or others social economic vulnerabilities, the approach of the link worker has to be completely different. So I think the training, it's really important. And also the training because the link worker, it's also someone that it's really key in social prescribing circle, because it's also the person that has to link with the physician, has to motivate him to continue this kind of program. But also it's really important to have the motivation of the social responsibles or the arts responsibles or cultural responsibles in order to have a cycle. And I think the social prescribing, we need to understand that the social prescribing is a circle, and it's not only to give the opportunity for someone to go to the activity. Then we have to understand what kind of effect this activity has, and then it has to link with the physician or the medical doctor or the nurse, health professional, in fact, depending the programs. But I think that's why it's so complex at a certain way.
Yeah, thank you.
And only one short remark that in our country, link workers, or as we call them, coordinators, also need supervisions. As I mentioned, not to leave them alone.
Yeah, it's a lot of moving pieces indeed. Yes, I see a hand. Oh, many hands. All right, well, let's start here. This is great. Could you come to, I think it's a green, you're wearing a green dress? Yes. And then after, yes, I see in the back row. So.
Hi, I have a question regarding, you mentioned it's a very different approach for our medical facilities, of course, to do the social prescribing, but I guess also for patients. Do you have experiences on, like, do people resist, patients resist to take this kind of offer? Do they lean more towards medical, like what they're used to, like medication and stuff? Because, I mean, I'm a big fan of this, but I'm wondering, what is your experience on that? Thank you.
Please, any one of you.
It really depends also on the culture, how it is already the primary healthcare, how wide is the primary healthcare team, for instance. In some countries, the team is wide. There is also other specialists involved, and that's then easier also to implement this kind of health promotion initiatives. And in some countries, it's quite popular already to implement the physical activity by prescription. And then, you know, this arts and prescription comes also, it's much easier. The biggest thing is where the doctor maybe see also a value is that through this program, it's like a catalyst for change for the person who is struggling. And it can build motivation and self-efficacy. So that also means that the person will adhere with other treatments better. But it is definitely, it needs a lot of like, you know, steady approach and constant. It can't be a random and a sporadic thing.
I think, Stina, you wanted to add?
Just a short comment too. We call our program a diagnosis-free space, which is very attractive to some people. Some people really don't like talking about mental health issues, or taking pills, or even going to a psychiatrist. That is scaring for a lot of people. We have tried it for only men's group in Denmark who has a crisis, and they don't like to talk too much about they have a crisis. So they have participated in these activities, and they love it. So I think it's also an offer for people who might not seek the traditional offers as well.
Thank you so much. Yes, we have a question in the back corner here.
Hi, Urška from the National Institute of Public Health. I was wondering, is there a specific path for a patient who finishes then these 10 to 12 weeks? Is there a specific path, or does the link worker help them find a suitable NGO where they can continue some freedom activities? Just if you have maybe some examples of models how you did it. Thank you.
Yes, in this project, Arts and Prescription, it is a premise that everyone needs to figure out how we can offer them something different afterwards. For the young people, some of them have actually been offered internship at the cultural institution, some work, because they really love to be there. But we are including associations in the project too, so they can continue activities after a program has ended. And like Ulla Kain just said about that, it's very different from different countries how these follow-up activities should work. It's the same with the different participants. They need different things. Some of them would like to just stay friends and go to the museums together afterwards. Some really would like to continue in facilitated activities, and some, are ready to take a job at a cultural institution.
Can I just very quickly? I think we normally tend to talk about that we don't have the integration of care in health sector, but at least in our perspective and our experience, sometimes the social responses are not also very well integrated. At least, for example, one project that we had that it's about music and motherhood with recent mothers with postpartum depression. What we have seen is that most of the time, because they are in these sessions about music, then after the program they are more open to also talk about the social vulnerabilities they have and economic vulnerabilities, and then they go to social security services. So there is a link also with some activities of social prescribing, and then they are more open. It's because we start, someone mentioned, we start an activating process of the people, so they are also more open to other services and other experience.
Thank you. Yes, one more quick comment.
Yeah,
yes.
Can I give an example of this? Because we work with older people. So when they are activated, for example, we can offer them to third age university, and they continue to do this. It is easier for them. And also one more example from our experience is volunteering. When you are helping others, it is easier for yourself. So it's proved already, I think.
Thank you. Those are great examples. And I see more questions. I don't want to forget about our online audience, so I'm going to come to Afsana and see if you've got a couple of questions that have come from them. And we're very close to time. It's 6:39, so let's see how we can do in the next 6 minutes.
Thank you, Alice, and thanks to our online participants. They have been engaging very well with us, posing excellent questions. And there has been a number of questions on the evidence around the outcomes and impact, and specifically on the cost effectiveness of social prescribing, and that breaks down to what is the economic implications on our health systems, but all systems in general. Also, what is the evidence on effectiveness on it, but also on different kinds of prescriptions, so for each social, green, and arts. And one other question that I really liked, because it's very timely, what does it mean for resilience and preparedness of our communities? Because it has shown to increase community belonging and reducing individualism. Yeah.
Super questions. Thank you, online crowd. And I think, Sonia, you spoke some about. Do you want to take a first go at this? And then I know we had at least a
quite
few more.
difficult in 2 minutes because it's a lot of questions. But so I think nowadays we have a very critical and robust evidence in UK, because they have a long tradition in social prescribing. So we have now very good evidence about all the points that you have mentioned. But for the countries that are starting now, I think, and this is something that we have been discussing, I think we are very urgently need evidence, but what we have seen is that first we need to have good social prescribing initiatives, and they are complex and they need resources, and most of the time we need training, and we need time also to change the cultural and the ways that we are thinking. So what we have been now in the beginning, in the first 2 or 3 pilots, we were really focused on effectiveness and this kind of indicators. And now we are more ready also to spend some time in terms of having very good implementation and design interventions according to resources. I think this is something quite important, at least from my perspective. Social prescribing should also maximize the resources that we have already in place. It cannot be only putting more resources in one initiative, and this takes time. So I think there is quite long evidence. I think in the beginning, the evidence that we have, it's more qualitative, and people mentioning that they are quite satisfied, the change that they have feel in their lives, and not so much in the first or second year, not so much changing in the health indicators. But if someone are really interested regarding the questions that we have online audience, I think UK nowadays has a strong evidence all health dimensions.
Thank you very much. Would anyone like to take the question on preparedness? And then I'm just going to give Floris a heads up that will come to you in about a minute. So, but would anyone like to take that last question on preparedness and that connection? Neringa?
You know, it's difficult to say preparedness for what, but if we are connected, it is easier. So very shortly.
Thank you. That's great and short because we are very tight on time. I know there were a few more hands, so I feel really guilty to pick just one. Would anybody like to ask the last question of the day? We've got, let's do one more here, and then we'll have time during dinner. So don't worry, we're here the next few days.
Thank you very much. First of all, this is a fantastic session, and thank you for all your presentations. I bring a different perspective. I work in health system development. My name is Elisabeth Campestrini in countries of transition for mother and children health. And maybe you all know these pediatricians from the US and UK that work like you to make children less afraid of vaccinations and other pediatric causes. So now the trust issue comes in. Do you have any pilots, or would you know of any examples where children patients gain more trust, for example, via these percussion approaches? Or generally, wouldn't you agree that pediatricians now in particular should all be forced during medical studies to have some sort of artistic approach also in this regard? Thank you.
Interesting question. Any takers?
But I have a sad example though from a child who lost a parent at a hospital, and it was very difficult for this child to take the last look at the parent, and they had experimented with using musicians, and a musician came to the child and brought music to the child, and this was actually a way to take the child into the room. So sometimes art can be this spiritual element that can create a safe space in a very sad time. And it was very, very, of course, important that this child could say goodbye. So this is an example.
Very poignant example. So thank you for sharing that. Wow, great questions. I think there's so much more we could still touch on, but we are basically at time. So I don't want to forget our other artist who's with us here for the session, and I don't think Floris needs an introduction to any of you who are Gastein regulars. I know I was impressed with his work when I came for the first time 2 years ago. Would you have some visual representations of what you took away from the session?
Do you need me to elaborate? No? Cool.
Others you had
made?
Yeah.
Oh, sure.
That's fabulous. Bring a friend. Yes. That's fabulous. Ah, the A-team. Very nice.
Thank you.
Thank you so much, Floris. Thank you. That's brilliant. That's brilliant. So I think a couple of years ago, they were for sale at the end. I'm like, I might need those juggling dolphins in my house. My husband didn't know, but I might need some juggling dolphins. Well, thank you first to this phenomenal panel, to our spectacular artists. Thank you so much. Thanks for playing along with us here in the session. And I don't have any closing words. I think it's just part of a continuing process. I think we're very fortunate that we're amongst the first workshops here. We hope to run into you. Don't hesitate to come up during a coffee break and have a chat, dig into the cost effectiveness. With that, maybe we can invite Richard to give us would you like to give us a particularly melodic exit from the room? So to close out the session.
So I want my colleagues to join me. So please stand here, please. I've seen you are very, very good. Your coordination and your music is very good. So please stand there. So please get up. Please join us and speak with us. Stomp, clap, butterfly, see you soon. Bye-bye. 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 Stomp, clap, butterfly, see. Please keep going, keep going, keep going. Clap, butterfly, see you soon. Bye-bye. Keep going. Clap, butterfly, see you soon. Bye-bye. Stomp, clap, butterfly, soon. Bye-bye. Stomp, clap, butterfly, see you soon. Okay, rumble, rumble, rumble. A left turn, a left turn, a right turn. We go to the thighs of the neighbor. Crescendo, crescendo, crescendo. Your own thighs, right, your left neighbor. Ah, it looks very nice. Okay. And we finished. Thank you.